Dear viewers, we have Dr.Sridevi with us, obstetrician gynecologist. Today, let's learn the importance of exercise in pregnancy. Can you share, doctor?
Yeah, sure. Thank you. So many of the pregnant women may have a doubt whether they can exercise, who should exercise, what kind of exercises. So actually, if your pregnancy is a healthy, normal pregnancy and you have no complications and your body, you're already used to exercising, then exercise is safe in pregnancy. If you have any doubt, you can always consult your obstetrician and gynecologist regarding that. So usually there's no problem when they do a limited aerobic exercises or normal exercises, kind of stretching or walking, jogging. So the minimal exercises, then there is no problem. But there are some people who should not do exercise during pregnancy. So who are those people? Is when previously they have a history of preterm labor, or if they have a history of anemia, because we don't want exertion. So because of that, we don't advise them to do exercise. And also if they have other like your membranes have ruptured earlier, or you have a cerclage, that's when you have a second trimester abortion or in multiple pregnancy, they will put a stitch in the cervix, that's called as encerclage. So when you have an encerclage, those kind of people should not exercise. Or you have a heart disease, so any chronic disease, any high risk pregnancy, for example you have a heart disease, or you have pregnancy induced hypertension, or you have a multiple pregnancy, that's for example you have twins, and a history of preterm labor or history of abortions, those kind of people, it's advisable not to do exercise. It can be minimal or a bed rest depending on your condition. Others, generally you can exercise. So what is the average exercises? Around you can do for 5 days, 30 minutes in 5 days for a week. But suppose you're not used to exercise, previously you have not started. So when you start to exercise, you start initially for 5 minutes. And then you have no exertion. Then weekly you can increase it to so next week you can do it for 10 minutes, then 15 minutes. So like that up to 30 minutes in a day for 5 days. You should not always exert. When you have any pain or any symptom like bleeding or any membrane rupture, or you get tired, you should stop just a level before that. So because it's difficult to treat after any complication. So before that you have to stop it. And any very like scuba diving, skydiving, those kind of exercises only we do not advise in pregnancy. Anything from height or very severe jogging, yoga and stretching can be done, but as we said, prolonged standing or prolonged lying down in the bed again can cause complications. So dependingly you can minimize that kind of exercises, because as we said, it reduces the blood pressure. So it can be done in a slow and a steady manner under a obstetrician and a gynecologist consultant.
Yeah, exercise is really very, very good because it gives a good hormone. Once people used to exercise, when they stop, they feel depressed. Any new form of exercises to starting in pregnancy, as the doctor said, it may not be advisable. Even swimming, if you are used to that, is a good exercise. And before pain, that's a very valid point. Yoga postures which is not contraindicated, you can have a consultant yoga also, which are the contraindicated postures that you don't do. Otherwise, some of the very simple things, butterfly or vajrasana, padmasana, small sitting postures, that can be done along with breathing. Breathing also is a very good form of exercise. Breathing, because your vital capacity, your lung capacity has to be increased. The patient has to withstand the labor, So exercise is really mandatory for a normal pregnancy. And no need to be pampered yourself. Exercise can be done except in case of repeated abortions or any very high risk where the baby is imminently going to deliver high blood pressure and all. For diabetes, it's a mandatory. One of the treatment part is exercise. I think these are the components. Any exercise you can start with. As said, slowly, then gradually increase. And really, we are thankful. Let's have a beautiful. Walking is a beautiful exercise. Walking with nature. If you are fortunate enough, you have a lot of trees, walking on your own. Even you can have some kind of podcast or some kind of music. We can develop. Same time walking, you can hear some music, some positive, motivational things. Just enjoy the walking and If your husband with a family can catch shoulder the hand and you can walk together, that they advise in some of the centers because you feel good vibes. That's a good exercise. Good walking for a long distance. Enjoy. Okay? Have a great time. Thank you very much.
Thank you.